holistic care is becoming such a game changer in mental health? Welcome to Growth with Joyce. We the future, confident in action. I hope our week has been going well. Yes, let's dive into it. This is because it isn't just about treating symptoms. It's about addressing the whole person. Our mental health is deeply connected to our physical health, lifestyle, relationships, and even our environment. Yes, please, have you subscribed yet? Please like, share, comment. When we look at the bigger picture, we can uncover root causes and create meaningful, lasting healing. Yes, we can do that. We can in our setting. Holistic care emphasizes the importance of integrating various practices like nutrition, exercise, more mindfulness, and therapy. These elements together to support the mind and the body. Yes, for example, nourishing our body with healthy food can boost our mood, while mindfulness practices may help manage stress. When all these pieces align, it creates a comprehensive foundation for mental resilience. From my experience, you cannot separate physical from mental health at all. You can't. Moreover, holistic approach promotes self-awareness, of course, and empowerment. It encourages individuals to take an active role in their healing process. That's very correct. Understanding what triggers their mental health struggles. Yes, when they understand, they'll be able to put more input. Personalized care focuses on a sense of control and confidence, helping people build sustainable strategies for managing their mental health long term. That's a very good strategy. Ultimately, embracing holistic care in mental health means recognizing that healing isn't one size fits all. Is about celebrating the unique journey of each person, fostering balance in all aspects of life. Because when we care for the whole self, mental health becomes not just a goal, but a sustainable way of life. So, holistic care is very important. Sometimes when people are going through mental health challenges, people just feel, oh, let me deal with just the mental health aspects. No, because from experience, mental health most times don't just happen on its own. It can happen as a result of physical health. It can happen as a result of stress trigger and all that. So when it happens, it is good for us to think about the physical aspects, because when that physical aspect is looked into, maybe somebody's got diabetes or has got a long-standing end-of-life disease, the person might be thinking too much, might be thinking of how the illness is going to go away, and that can trigger the person's mental health, and that person will become unwell. So when we are treating mental health, we have to look at every other aspect. The social life of that person. We have to look at their relationship, whether marital, whether with families. We have to look at that. We have to look at their finances. We have to look at that because those can impact on their mental health. We have to look at their accommodation. because sometimes maybe they don't have a place to rest their heads. That can trigger mental health disorder. Maybe they've lost their job. That can trigger as well. So we have to look at provide holistic care for patients. It's a whole person. So we have to look at that so that when those things are tackled, when those things are dealt with, you will see that, you will notice the patient will start getting better. Will start getting better because he knows, oh, my accommodation is now sorted. Oh, my physical health, they are still investigating it, but they are putting a lot of effort. You will see changes in the patient. You will see the way the patient will be behaving. When the patient, if he has issue with his finances, and you start looking for ways to support the patient. Maybe the patient hasn't got a job, or there has been a problem. If you sort out that, you will see how the patient will start getting better. So holistic care is so important. Or the patient is having issues, other issues, or maybe the patient is having issues in socializing and is finding it difficult. When you put this in place, you will see that the patient's mental health will start revamping. So holistic care in our setting is so important. Sometimes people just feel, oh, because of the mental health, it's just mental health. They need to deal with mental. You don't need to deal with only mental health. You need to deal with the physical, the social. You need to deal with other factors. So that's why when we are doing what they call care plan, which I'm going to make a topic on, we have to look at holistic care. Holistic care is so important for patient's recovery, because if you don't solve this one will start, the other one will start affecting the next. So it's so important that we look at holistic care seriously. Leave in the comment section if you will be providing that in your settings. Leave in the comment section if it's something you like to try. Leave in the comment section if it's a good thing to do. It's a good practice. Thank you so much for listening to me today. We the future, confidence in action. Thank you. Bye-bye.